Are you suffering with knee pain? Imagine spending $15,000 to $20,000 on a medical treatment and doing no better than if you had done nothing at all. That is precisely what several studies say about arthroscopic knee surgery. The New England Journal of Medicine studied this procedure on 2 separate occasions. The most recent study of 178 patients showed that those who had arthroscopic knee surgery fared no better than those who had no surgery at all. The question you have to be asking yourself is, why? The other question you have to be asking yourself is, why is this one of the most common surgical procedures performed today? And if medical procedures fail like this, why are not more patients being told about alternative therapies? So why doesn't arthroscopic surgery work? The plain and simple answer is it is just not getting to the cause of the problem. You see, you cannot just cut open the knee joint, remove pieces of the structure, and expect to improve upon the health of the joint. At very best, you are only going to get temporary reduction of pain. So what about cortisone injections? There are so many things wrong with cortisone injections that I do not have time to cover all of that here. However, keeping to the subject of knees, here are some of the side effects of cortisone injections as stated by Cleveland Clinic. Cortisone injections carry a risk of complications such as death of nearby bone called osteonecrosis, joint infection, nerve damage, skin and soft tissue thinning around the injection site, flare of pain and inflammation in the joint, tendon weakening or rupture, thinning of nearby bones. There are limits on the number of cortisone shots a physician will provide in one joint, for there is evidence that repeated use of cortisone may cause deterioration of the cartilage. In general, cortisone injections are limited to 4 in any one joint over an entire lifetime. This is quite telling. Really? Cortisone actually causes the joint to worsen? How many times has a medical physician cautioned a patient that a cortisone injection could actually cause joint degeneration? And how many patients know that the number of cortisone injections is limited to 4 in one joint over a lifetime? You see, the knee joint is one of the most complicated of all the joints of the body. It is supported by 2 C-shaped cups of cartilage called the meniscus. There are many physical imbalances that can affect the way the tibia, the bone of the leg, and the femur, the bone of the thigh, articulate or come together. Just like the tires on your car will wear if the wheels are not aligned properly, the cartilage or meniscus of your knee will wear if the structures around them are not aligned well. This is one of the main reasons arthroscopic surgery does not work. It does not correct the structural imbalance that leads to the degeneration in the first place. Your tires were wearing abnormally on your car, and you cut off that tread. That would not fix the problem. Just as arthroscopic surgery, cutting away pieces of the cartilage, will not fix your knee problem. A major difference with the approach Dr. Schneider has developed is a focus on discovering what has caused your knee to become a problem in the first place. Dr. Schneider has great success treating knee problems, for he takes a comprehensive approach. He will analyze and correct the structural problems that cause the knee to become symptomatic. He will use acupuncture to help in the pain reduction and healing process. A meta-analysis of 14 separate random controlled clinical trials involving 3,835 patients by the Healthcare Medicine Institute concluded that acupuncture provided significantly better relief from knee osteoarthritis pain and a larger improvement in the function than standard care treatment, which included pain management with medication, cortisone, and arthroscopic surgery. Dr. Schneider will also use different manipulation techniques and muscle release procedures to help rebalance the way the joint moves. Dr. Schneider has experience in treating all levels of knee joint problems, from simple sprains of the knee to arthritis, cartilage and meniscus tears, and even failed arthroscopic knees and symptomatic knees after joint replacement. Common sense. Common sense dictates you should always try the least invasive, safest treatment first. If your first approach is surgery, you will be missing out on the opportunity to resolve your knee problem safely. There are studies and research that support conservative alternative therapies for knee problems. So why would you use other procedures that have been proven to have poor outcomes? Most individuals simply do not know the facts. Many individuals do not know they have options. Imagine how happy and excited you would be to resolve your knee problem without surgery. Then you can reflect back on this decision and know that you did the right thing. You took the common sense, safe approach first. Listen to what a few patients have to say. The proof is in the results.
Okay, go ahead.
All right, this is David Bailey. David came into us with a knee condition. Tell us a little about your knee when you first started here. What was going on?
I had a torn meniscus. I'd gone to a sports doctor and a surgeon. They naturally wanted to do surgery and cut the meniscus off. Doc said he could heal it. I trusted him. I'm at the end of my treatment right now. I got one more session, and I feel I'm about normal.
Okay. So, that's pretty good. David was supposed to have surgery, and he responded very well to conservative care, and so avoided surgery. Very good. All right, thanks. About his knee. We've been through his treatment protocol for his knee, and why don't you tell us a little about your knee when you first came in and how your knee's doing now?
When I first came in, I had trouble walking without, with pain, especially going up steps. And right now it feels a lot better.
Well, I think what's unique about your case also is your age. How old are you?
83.
Yeah, so an 83-year-old man with some degenerative knee condition and difficulty walking, and with conservative care, he's responded very favorably. Now, Robert also had, I think we identified a herniated disc in your lower back, and you also had some numbness in your leg and difficulty with raising your foot.
Yeah, like my foot was dropping as I walked, and I was losing feeling from my foot up to my knee, as in the right leg.
And that also resulted in some imbalance also.
Right.
Instability, difficulty with walking and being stable.
Right.
And how's that doing now?
Very good.
Good.
I'm pretty stable in walking now. And as far as my flopping of my foot, it's not 100%, but it's a lot better.
Good. Very good. All right, thank you. For more information, you may contact Dr. William Schneider at the Pain and Wellness Centers in Warren, Ohio, and his phone number is 330-372-7246.